Okay, then we can move to our next speaker, right? And it's our pleasure to introduce our next speaker, Dr. Olena Kuriata, who is a One Health consultant within WHO country office in Ukraine. And prior to her position, Dr. Kuriata spent 9 years working as a civil servant for the government of Ukraine, leading international relations within sanitary and phytosanitary related issues at the State Service of Ukraine on food safety and consumer protection, and trade-related issues in the Ministry of Economy of Ukraine. So today she's going to present on One Health in Ukraine, interaction, obstacles, and building bridges, and about all activities conducted by WHO in Ukraine.
Yeah. Hello, colleagues. Good morning and good afternoon, everyone. It's my big pleasure to attend and participate in this international conference. It's a big pleasure because NULES is my alma mater. So each time I get some kind of invitation from the side of NULES, I'm very excited to go on and jump into this type of opportunities for me. Thank you so much, Valeria, for introducing myself. I'll share my screen. Let's try. Usually I use Teams, so I'm not sure, possibly I'm not able to do that. Yeah, so possibly, Valeria, if you may help me and open my presentation, because I think I should have done some kind of technical arrangements here within.
Just give me a second and I will do that.
Because I have this function, but it's like, it doesn't work.
Today, technology doesn't work for us.
Hopefully I have electricity.
Yeah. Okay. Okay, can you see that?
Yeah, that's perfect. It works. Thank you so much.
The floor is yours.
Yeah, thank you. So I've been asked by the organizers to prepare the presentation in Ukrainian, so that everyone, Ukrainian colleagues and students, will manage to understand the presentation. But I'll speak in English for the best of our international colleagues' understanding. So next slide. I'll speak a bit the One Health approach in Ukraine, which is actually not the new opportunity, not the new initiative. This is the initiative that had been introduced some period ago. However, it became more and more like kind of popular since the COVID pandemics and influenza pandemics, as well as rabies that is spreading in particular in Ukraine as well. And this approach links together different types and sectors of colleagues in order to implement, develop the best practices and of the cooperation and collaboration between those sectors in order to improve and enhance the public health sector. Next slide. So the areas that includes and combines the One Health approach, it's food safety, zoonotic diseases, laboratory services, environmental health, and antimicrobial resistance. And as you may understand, all these sectors, they are interconnected between each other. And I will speak a bit the gaps and kind of issues or problems, let's say, that are present in Ukraine, and what we are doing as a WHO to abolish and to try to connect all these sectors in between each other to cooperate together. Next slide. So yeah, this approach and initiative, it helps to build bridges and between different types of vertical sectors. Let's say it includes the cooperation between governmental services, ministries, agencies, NGOs, international organizations, scientists, universities, environmental health specialists, veterinarians, ecologists, medical services, like medical care providers. Next slide. And actually, why is it so important? Why do we start talking about One Health like for a couple of years ago? Because of the global situation, because of the globalization that actually brought very simple travels all across the globe, and the global trade that has been increased, and you can find Ukrainian products, let's say, in China, in Europe, in America, and as well. We became much closer to animals, not only to pets. And another area is about the climate change and the land use, which all these sectors, all these issues, they became more and more integrated to one each other. That's why we have to use the one approach in order to to fight against one issue altogether across all the sectors. Next slide. Possibly, yeah, the image didn't download it. However, due to all these factors, four of international organizations decided to cooperate one with each other, and they developed, at first it was a tripartite alliance, and since this year it became a quadripartite alliance. And this alliance combine joint efforts of the WHO, Food and Agriculture Organization of the UN, UN Program on Environment, as well as World Organization for Animal Health. And this quadripartite alliance, they developed a guide for all the countries on how to communicate, coordinate, and how to build the capacities within each country, how to manage the issues that actually tackles the sectors and disciplines within One Health. Next slide. So yeah, this is the tripartite guide addressing zoonotic diseases in countries, and it actually possess the multi-sectoral approach for planning and response, for the risk assessment, the joint risk assessments to be carried out by all the sectors together in order to tackle the diseases, how to cooperate within different sectors, how to monitor and share the data, share the information, and why is it so important to share the information within different sectors, how to communicate about the risks, and how to investigate and how to benefit from all this using the One Health approach. And actually, I need to speak here possibly that in Ukraine, it is quite challenging situation if we are talking about the regional level or local level of communication between different sectors. It possibly, for sure, it goes and it depends on the personalities, but historically speaking, human health sector and animal health sector, they didn't have like good connections. And we are trying to build these bridges between these two sectors, trying to give the understanding for both of them that each of the area, each of the sector is quite important. But if one sector will go and for the investigation of, let's say, anthrax case, they will be lacking of information. So therefore, the efforts should be done jointly, and only in that case the effectiveness will be actually present. Next slide. So last year, at the end of last year, we had the joint risk assessment, joint external evaluation done by the experts, international experts. They came to Ukraine physically and carried out almost 60 different meetings, online and offline, asking and questioning the different sectors of Ukraine in terms of public health. It was the representatives of Ministry of Health, Ukrainian public health sector, State Service of Ukraine and Food Safety and Consumer Protection, laboratory services, universities, and different type of NGOs present, and they've been asked by the experts in order to understand the clear picture of what is happening in Ukraine, what are the gaps, and all this evaluation was split into different 19 technical areas. So we received kind of scores for each of that sector and the recommendations on how to implement and do better, what we need to do and how we need to address those gaps. And actually one of the main comment, one of the main recommendation given by the joint external evaluation was actually related to the implementation of One Health approach between different areas and sectors and ministries. And now the work is going on about the development and drafting of National Action Plan of Health Security, which is like the next step after the joint external evaluation. Given the results and scores we had, we need to kind of list those recommendations into the action plan and implement that. But the work is still going on. We all are we all been kind of pushed back because of the full-scale war, but still we need to do that because the work on the effective implementation and improvement of the public health sector should be done like day by day. So we cannot stop doing this. We need to improve our public health system as well as all other systems which need to be addressed. Next slide. Okay, this slide also doesn't show the whole images. I'm so sorry. So the situation about the authorities which are responsible for the One Health here in Ukraine, they are kind kind of split it. So the food safety and zoonotic disease response, it's under the Ministry of Agriculture, food safety issues under the Ministry of Health, and the implementation agency is the State Service of Ukrainian Food Safety and Consumer Protection. While the sanitary epidemiological welfare and well-being, it's split it under the Ministry of Health and the food safety agency. So it used to done in 2016, 2017, when we had like a great reform of the public health sector and the food safety agency, when the government decided to go and to follow the EU regulations and EU approach and establish the competent authority on food safety, taking the whole chain from farm to fork approach. That's why the State Service of Ukrainian Food Safety and Consumer Protection was established, but the functions on the sanitary epidemiological surveillance and well-being, it was split between the Ukrainian public health sector and food safety agencies. So it is very essential and vital to have this connection in between these two agencies. And now it's like, it's a crucial, but still we are lacking of the cooperation between these two agencies. It's frankly speaking. Next slide. Yeah, and the legal basis, what we do have right now, it's a strategy on biosafety and biosecurity using the One Health approach until 2025. But this strategy actually covers the obligations to develop and draft some kind of legal acts, and it lacks in practical implementation and using the One Health approach. And then we also have the strategy, another strategy on biosafety, biosecurity that was adopted by the president, and the action plan to implement this strategy. The recently adopted law of Ukraine on public health system, and it will be active, valid, starting from the 1st of October next year. And actually this law has a provision, the term, what is it, One Health. So it's like our basis for the steps forward within One Health. So finally, we have this law and we have this term, and this law also foresees to develop up to 80 different sub-legal acts in terms of cooperation and interaction between different areas in terms of One Health, how to do the response together, how to do the surveillance together, and also it foresees using the common database for outbreaks and of diseases, infectious diseases. Now we also have the Ministry of Health order with regards of investigation, joint investigation of epidemiological surveillance. And can we say that it actually works, within different regions in Ukraine? I'm not sure. However, like in last month, in October, we had an outbreak of anthrax in Kyiv region, and I did some kind of monitoring of how the response was carried out by our different sectors, human health and animal health sector. And I need to say that this order was actually implemented by those sectors. So the quarantine was established, the people from the farm was also under the monitoring, and they prevented the jumping in the disease from animal to human. So in this case, like Kyiv region has a good cooperation between these different areas. Next slide, please. Yes, so about the gaps and the potential needs that we need to speak of and we need to contribute. in order to enhance. So we need to have the SOP with a strict, step-by-step functions of different sectors about the information sharing, because now it's working only due to the ministerial order that I spoke about within the previous slide. But these, like in practice, it works only using the personal understanding and personalities. If people know each other, and they can just pick up a phone and call or text a message, then it works. But there is no like paper outlining, the emails or the sort of messages that should be provided from one sector to another. Then we shall speak about the common database, about the outbreaks and sharing information about these outbreaks. Now the Ukrainian public health sector, they have the EADS system in place, and they actually use it, and it was created due to COVID outbreaks, and they use it for COVID outbreaks. But initially it was the interest was to use this system for both sectors, veterinary and human, in order to have the clear picture and the joint picture of what is going on within different sectors. Let's say rabies, it can be detected within animal health sector and the human health sector, but the information exchange about these cases can be done only if the official letter sent from Ministry of Health to the State Service on Food Safety, and it is not working. I mean, if in case you're asking for the list of outbreaks and you are waiting, you need to wait like 10, 20 or 30 days to receive this information, that's not the effective sharing of the information. We shall speak about the trainings and improvement of knowledge, both within the staff that is now working within the government, the people in place, the field epidemiologists, but we are also need to speak about and to understand that the system is building from the very, very base. That means from the universities. So we have to contribute in the in students within Global Health and One Health initiative, using this initiative within the curricula for both human and animal sector. And we have to work for the improvement on the cooperation of people who are working in fields and regions by carrying out joint trainings, joint simulation exercises, to bring people around one table and to speak about one joint problem or outbreak, that like using the simulation exercise. Next slide, please. Yes, and about the next steps and our plans as a WHO. Now we are cooperating with the CDC US to carry out the workshop on zoonotic prioritization list, because we in Ukraine, we do not have this common list of zoonotic diseases that are in a priority. We are planning to do that next year, hopefully in the first quarter, but hoping that the situation won't be evolved. And the next one will be the joint risk assessment. And for the joint risk assessment is a tool developed by the Tripartite Alliance. And for this joint risk assessment, actually, we need the list of zoonotic prioritized diseases. So the first step is a workshop from the CDC, and then the joint risk assessment. And we also need to complete drafting the National Action Plan on Health Security and start implementing it and monitoring its implementation. And then the National Bridging Workshop, that actually like a huge workshop that potentially includes from 60 to 80 people from different areas of implementing One Health, like Ministry of Agriculture, Ministry of Health, UPHC, veterinarians, food safety, animal agencies, universities, stakeholders, environmental health. And these, like a huge event, should have been actually carried out in 2022, but due to full-scale war, we are not able to put all these people under the risk and make it possible, but we are keeping our fingers crossed to make it happen next year. And in our plans to conduct 3 simulation exercises within different type of response. And one of the simulation exercise will be touching the zoonotic or foodborne disease. We'll see. Now we have like lots of plans, and we do hope that the situation will be much more suitable to make it happen. And we all know that we are working for the best of Ukraine. And I think that with help of international partners, using the best practices, we can do our best, and we can make Ukraine like very, very good country. And next slide. Yes. One health is everyone's health, and the paws of my dogs are clean. Thank you for attention. Yeah, I'll be happy to answer any questions you have, in case you have, or you can reach me out by email in case you have any kind of proposals or initiatives that possibly can be conducted or implemented here by using the help of WHO, and I'll be